Good morning, everyone. I'd like to take this opportunity to call us to order. My name is Greg Hager. I'm the director of the Malone Center for Engineering and Healthcare. On behalf of myself and our team and our co-organizers, the Armstrong Institute for Patient Safety and Quality, it's my pleasure to call us to order and open up the symposium. We have a really full day planned for you. Whenever you start these things, you always start out and you think, well, what are we going to do with the day? And by the end of it, you find out there are so many things you want to do that the day gets really packed. But I think it's going to be a truly interesting, rewarding, and really a day that's an opportunity for all of us to do some learning. But before I get into that and frame out what we're going to be doing today, I want to first give Ed Schlesinger, the Benjamin T. Rome Dean of the Whiting School of Engineering, a chance to welcome you and offer his perspective. So, Ed, a few words.
Thanks, Greg. I really wanted to just say three things to you here. The first is welcome. Welcome to this second annual symposium on engineering and healthcare. We started a tradition last year, which I hope will continue and grow in the years to come. The second is, and I know I speak to I'm really speaking to the choir here, we have tremendous opportunities before us at the intersection of medicine, healthcare, and engineering. There's no question that the application of technology, of systems thinking, of data analytics, big data, artificial intelligence, all of these things will have huge implications in medicine and healthcare in the coming years. And so the opportunity we have to make an important contribution in that area is truly a privilege. The third thing that I wanted to say is that we have another privilege. The fact that we are here at Johns Hopkins University, where we have arguably one of the leading medical institutions of the world, partnering with engineering to actually bring improved care to patients, to actually improve people's lives through this collaboration, is a tremendous privilege as well. And so I think we should be really careful stewards of this opportunity we've been given to both advance the field significantly and implement those advances for the betterment of people's lives. And so I think it cannot be overstated how important and valuable all that you are all doing is for our society and for our country and for the world. So thank you and welcome.
Thanks, Ed, and thanks for your support for the Malone Center. I want to spend just a few minutes giving you a little bit of perspective of what we are trying to do today. As I said, you start out with a blank page, and you'd really like to find a theme that ties the day together and really kind of pushes or advances the frontier a bit. And that's what I hope we've done today with our theme, teaming with technology along the healthcare spectrum. So the starting point of this is, I think we can all agree, we live in an area where technology innovation, particularly information technology innovation, isn't just kind of the normal course of events, but it's actually almost our expectation that we're going to see better, newer, faster improvements due to technology, particularly information technology. So I think in that context, most of us would really believe that information technology is in the broadest sense, is going to have a profound impact on our ability to deliver health care that's efficient, effective, and increasingly targeted to each individual patient. And in fact, we're going to probably not just use that technology in the traditional healthcare settings, in acute care, in the hospital, but ultimately it's also going to be employed to maintain health and well-being well beyond what we think of as a traditional healthcare setting. And we really will see, I think, technology being pushed more and more to the edge of the network, if you will. But it doesn't seem likely, to me at least, that just technology is going to be the answer to improving efficiency of healthcare. And why do I think that? Well, I think that because ultimately it comes down to the fact that healthcare is really about people, or organizations composed of people, taking care of people. And so we can't somehow just remove the people element from that equation. And so really, when I think about teaming with technology, I think about, obviously, the technological innovations that we're going to be seeing over the next decades. But at the same time, I also think about how do we bring people into that equation, hence teaming with technology along the care spectrum. So what I'd like to do, though, is to highlight a few different ways to think about that teaming. And this really, what I'd like you to do is, as you go through the day, to really reflect on this. How do we kind of think about technology in the broader spectrum of what we think of when we think of healthcare? So the first way I'd like to think about teaming is the obvious one, which is, technology is a tool, and it's an ever more intelligent tool that we're going to be employing more and more in healthcare. And so clearly we will be teaming with technology. It's going to be technology that enhances the precision and reach of a surgeon. It's going to be technology that provides decision support and lets a clinician make the best possible decision for a patient. It's going to be technology that manages scheduling in the hospital and makes sure that a patient has a bed or can get into a scanner or has nursing care when they need it. So that's clearly one aspect of technology. We will more and more be embedded with technology as we practice healthcare. But there's another side of teaming with technology, and that's building technology. Building technology, in my world, is also a team sport. If you think about creating effective technology that's really going to work in a healthcare setting, it's not about just building technology and deploying it. It's about understanding the users of that technology and also understanding the recipients of that technology, the patients in the hospital. And so really, if we're going to build effective technologies, we need input from doctors, from nurses, from patients, from administrators, and they have to be able to work with engineers skilled in data science, systems engineering, human factors, interface design, implementation science, and most importantly, they have to be able to work together with people who are from both sides, skilled at listening and understanding and appreciating everyone's problems and perspectives. So that's another aspect of teaming that I think today will exemplify as we bring together engineers and clinicians to discuss these problems. Just in that context, I want to give a shout out to our co-organizers, the Armstrong Institute for Patient Safety and Quality, and their amazing work on the people side of the frontier in the advancement of their mission to reduce preventable harm, improve clinical outcomes and experiences, and reduce waste in healthcare delivery at Johns Hopkins or around the world. It's really a perfect complement to the Malone Center for Engineering and Healthcare, which is seeking to bring technology innovation to the delivery of healthcare. So together we've put together a program that reflects our objective to broaden our minds and to reach toward a future of technology innovation that's user-centric, value-enhancing, and designed to support healthcare, health maintenance, and well-being. So let me tell you a bit of how the program goes together, just to give you a perspective on how we're trying to shape the day. So we're going to start with a keynote by Sarah Saja on maximizing the benefits of healthcare technology for consumers. I'll say a bit more about Sarah in a minute as I introduce her for a keynote. And then we're going to have two panels, and these panels really have been designed to explore the human technology frontier. The first panel will explore teaming with technology from the human side of that frontier, helping to develop our understanding of how models of people and organizations can help guide technology decisions. The second panel is going to explore the technology side of the frontier, looking at future technology directions that can enhance human physical and cognitive capabilities. Finally, there are two, I'll call them experiments, in this symposium that I'm very curious to get your feedback on. So the first is just to add a bit of spice to your lunchtime conversation. we've added a half an hour of what we call spotlight talks. What are spotlight talks? Well, we put out a call and said anyone who has a project where they would like to get a bit of exposure for this project, they're looking for collaborators, they think they have an idea that could become much bigger, we're going to give them 5 minutes to talk about what they're doing and to get that exposure and to get the opportunity to start a conversation around their topic. It's right before lunch because that means as you go into the lunch break, if you see something that interests you, you're going to be able to go and talk to them directly and maybe make a connection and help these folks out or get involved in something that interests you. The second experiment is what we've affectionately started to call our mini workshop. So at the end of the day, we've got a panel on precision and value in healthcare. And that panel is going to be chaired by Anthony Rosen, the Vice Dean for Research at the School of Medicine. And the idea of this panel is to first talk about precision and value, really using examples and ideas that are concretely taking place at Johns Hopkins right now. And then after that, we're going to break out into 4 different breakout groups led by each of those panelists, and that's going to be your opportunity to engage and provide your ideas and feedback and thoughts. And the goal of that really is to help us identify strategic directions that we might be pursuing within the Malone Center or the Armstrong Institute or institutionally, or more specific projects that really are there to advance team science and advancing precision and value in healthcare. So that's the day, and really you can think of the arc of the day as first exploring this human technology frontier, but then really trying to focus and say, what can we do to make a difference in that frontier? So in that regard, just before I introduce Sarah, I just wanted to give you one last thought on this notion of coming together and teaming. So last week, I had the pleasure of listening to Freeman Hrabowski, the president of UMBC, at a National Academies event in D.C. And during his talk, which was really very inspiring, I have to say, if you ever have a chance to listen to Freeman Hrabowski speak, I would definitely urge you to do so. It's a great opportunity. But during his talk, one of the things he talked about was, as he put it, the genius of the and. And I realized I liked that phrase so much, the genius of the and. And of course, what he meant is the genius of taking things that you think of as separate or competing or not really being together and putting them together and getting something out of it that you really didn't have before. And that's what I really like about it, is it's a phrase that just captures this, how can we put things together, the genius of the and. And that, to my mind, is really why we're here today and what this program is about. Because I think deep down we all are here because we want to make healthcare better. And making it better is going to require all of our unique ideas. It's going to require all of our talents. It's going to require all of us to find the genius of the and, to put our talents together, and to make something that's more than the sum of the parts. So I hope during the day that you really take a chance to learn. I hope you participate and interact. We've got wonderful speakers and panels, and it's a great opportunity to express your own ideas as well as listen to ideas. But ultimately, I hope you really keep an open mind. Wherever you come from, whether it's the clinical side, whether you're coming from engineering, whether you're a grad student, keep an open mind, and I hope that throughout the day you find opportunities to be inspired by the genius of the and. So with that, I want to keep us on time, so I'm going to turn the podium over to our keynote speaker, Sarah Sadja. Sarah is really, I think, a person who really epitomizes what we're talking about today, teaming with technology. Sarah is a Leonard M. Miller Professor of Psychiatry and Behavioral Sciences with secondary appointments in Industrial Engineering, Psychology, and Neurology at the University of Miami. She's also the Director of the Center on Aging at the University of Miami Miller School of Education and the Director of the Center on Research and Education for Aging and Technology Enhancement, CREATE. CREATE is funded by the National Institute on Aging, and it focuses on older adults and technology systems. Dr. Sadja's research interests include aging and cognition, aging and technology systems, family caregiving, older workers, training, and functional assessment. She's a fellow of the American Psychological Association, the Human Factors and Ergonomics Society, and the Gerontological Society of America. She's also been a member of the National Academy of Sciences Committee on Human Systems Integration and a member of the National Research Council and National Academy of Sciences Committee on Human Factors in Home Healthcare. And she's also the winner of a SIG-Chi Social Impact Award. For those of you who don't know what SIG-Chi is, SIG is Special Interest Group, and Chi is Computer-Human Interaction. It's the flagship organization for human-computer interaction and computer science, and she was the winner of their Social Impact Award. So she really is someone who spans the human technology frontier. So without further ado, I'd like to turn the podium over to Sarah, and I'm looking forward to your talk. Sarah.